Let's connect. And let's start our webinar. And our presenter tonight is Jacqueline. And I'll hand over to you, Jacqueline.
Lovely, thank you very much. Good evening, everyone. I'm just going to share my slides and then hopefully, Pete, can you just say yes that you can see them for me?
Yes, no problem at all.
Wonderful,
If you
thank
are
you.
just entering the webinar, please can you mute yourself as you come in as well?
Thank you very much for the kind introduction. It's lovely to see so many people on the call. So yeah, my name is Jackie Nevols. I'm a consultant nephrologist. I work at the Wessex Kidney Centre based in Portsmouth, and hello to everyone that I know already. In Portsmouth, I'm clinical lead for renal supportive care, which means I attempt to treat my patients with a holistic approach, focusing on symptom control. And my particular interest is in itch. I also have the privilege of being the co-chair of the UK Kidney Association Special Interest Group for Symptom Control, and we're currently in the process of writing some guidelines for itch and kidney disease, and I'm delighted to be able to talk to you about this today. So welcome. I just have one very quick disclosure just to declare before we start. So what I'm going to talk to you about for the next 25-30 minutes or so is what exactly is itch and why is it such a problem and why it affects so many people with all different sorts of kidney disease. There's actually quite a lot you can do yourself to help manage your itching at home, and I'd also like to talk to you today about various medications that can be prescribed in the clinic after discussion with your doctor. So let's get started. What exactly is itch? Well, it was
Haven't started
defined.
sharing yet, Jackie.
I'm so sorry.
You haven't started sharing yet.
I beg your pardon. Bear with me 30 seconds. Now, how's that?
And then that's it. Spot on. Thank you.
Please accept my apologies. So we were just on that. That's the overview of the talk. And then, okay, we're going to start talking about what exactly itch is. Well, it was defined about 400 years ago by a German physician, just simply as an unpleasant sensation that leads to the desire to scratch. This we all know. But why on earth do humans and other animals itch? Well, actually, we think this sensation probably developed to help rid the body of insects and parasites on the skin. You can imagine if something lands on your skin, you might want to brush it off so it doesn't bite you and give you a disease like malaria. But the itch we're going to be talking about today is absolutely not useful, and I'm sure you'll agree with that.
Oh, you're on it, are you?
The itch can be, the sensation of itch can come from anywhere, from the skin all the way along the nerves and all the way up to the brain. And I'll explain a bit more about that in a moment. It can affect any part of the body, most commonly actually the back, but it can affect the scalp, the feet, any part of the body. And it's annoying that it affects the back most frequently because it's the most difficult part of the body to put cream on or to scratch. It can happen any time of day and affect patients significantly worse at night sometimes, which can even impact on your sleep. So I promise this is the only scientific slide that we're going to look at this evening. And I just want to describe to you about the itch pathway and how we actually perceive itch. Now, bear with me, it's a little bit complicated, but I hope it will explain some of the treatments that we're going to be talking about later on. So the sensation of itch can start, first of all, obviously in the skin. And you can see a diagram of the skin here. It's divided into a number of layers. And the deeper layers of skin actually contain some parts of the immune system. You can see inflammatory cells there. And what happens if something stimulates the skin or these inflammatory cells, the nerves can fire. And that's the green and blue lines there. Now, interestingly, in the context of chronic kidney disease, and particularly in patients with things like diabetes, these nerves can actually be abnormal in themselves. You might have heard of the phrase peripheral neuropathy. And that means these nerves can fire even when they're not being triggered by a particular stimulus to do so. And that's really annoying. So the itch sensation travels along these nerves through the spinal cord and up into the brain. And this is where we perceive the itch sensation. The itch sensation can actually start all the way up here in the brain. And that's not for me to say that it's all in your head. That's not true. Wherever the stimulus starts, the sensation is absolutely real. But here's the funny thing, there is such a thing as psychogenic itch, And this means that you can feel itch just by the sensation starting in the brain. And this is what happens if you're sitting in the room with someone that's scratching, you might start scratching. And I'm afraid to say that some of you might even start scratching while I'm delivering this talk today, and I can only apologize about that. But it's really interesting that the brain is so heavily involved in this perception. So what about the itch in renal disease? I just want to talk about the terminology. You might have heard the itching called uremic pruritus. This is now quite an old-fashioned term, and I'll just explain what it means. Pruritus is the medical word for itching, and uremia is the term for renal failure. However, we now use a more modern term called chronic kidney disease-associated pruritus, as we know that itching affects pretty much all stages of patients with chronic kidney disease, not just those with uremia or those who are in the more advanced stages. And it's really, really common. I expect most of patients listening today have had some itching at some point or other. Now, what I find really interesting reading the literature is several studies have been done, and that patients with really quite moderately severe or itching that's bothersome, they don't even think to mention it in the clinic appointment. And we're not really quite sure why that is, but perhaps people don't understand that their itchy skin is related to their kidneys. And unfortunately, we also know that itching is underestimated by medical staff. So I do always try and teach my trainee doctors to ask about symptom control when they see patients in the clinic. And that's the first step actually to making the diagnosis, is to actually ask about it. It's also important to have a look at the skin, to examine the skin properly and rule out any other skin conditions that might be causing the symptom. It's quite a good idea in the clinic to put a number on it, or a measure of severity of how bad the symptom is. And there are a number of tools available that you can use. There's a couple illustrated here. And this is quite helpful the next time we see a patient in clinic to see if there's been any improvement, because it's really important that the treatment you're prescribing is effective. And if it's not, to try something else. I thought it might be helpful today just to show a few pictures of rashes and other skin conditions and things, just to help you come to the right diagnosis. Because interestingly, the skin with chronic kidney disease associated itching usually looks absolutely normal, at least in the early stages. So the first one I wanted to talk about today is eczema. This is otherwise known as atopic dermatitis. It's really common. It can occur at any age, but often starts in childhood and can be related to allergies and food intolerances and things like that. The most common sites for eczema are the crook of the elbow, in the flexor surfaces, and it can occur on the hands, and it's incredibly itchy and really irritating. A lot of the information we have about treatment for itching, the studies were actually done in eczema patients, and some of the treatments for eczema can actually be used in renal patients too. The next one I wanted to share is called urticaria. Now, this is otherwise known as nettle rash or hives. It's usually related to an allergy, but some people unfortunately get urticaria even with a trigger such as cold temperatures or even water in some patients. Now, urticaria is mediated by histamine, and it often responds to antihistamine tablets. The next one's a bit gross, so prepare yourself. This is scabies, okay? Now, I wanted to talk about scabies today, not only because it causes itching, but there have been reports of increasing incidence of scabies and even outbreaks, even things like university halls or nursing homes and things like that. So it's more common. And what scabies is, it's actually a mite infestation. And what they do is they burrow under the skin. Whether you can appreciate on the picture, there's a few arrows, they look like burrows under the skin. And it causes an intensely itchy rash, which is actually an allergic reaction to the mite's droppings, which is a really horrible thought. But it is treatable with creams that are available in any chemist. And as long as you've washed your bedding to get rid of any other mites, then it should be treatable. And the last one I wanted to talk to you today is about a drug reaction. This is common, particularly if you have an allergy to medications. The most common one is penicillin. And if you take penicillin when you're allergic to it, you can come out in a florid, itchy rash just like this, and it's often all over the body. And this sometimes requires steroids as well as antihistamines to get it better. But let's move on to talk about itching specifically in the renal population now. Now, what actually causes it? Well, unfortunately, there isn't really a one-size-fits-all cause. We think there are quite a number of things, but there's a decent amount of research now that's been done to give us an idea of what actually causes it. So the first cause I wanted to discuss with you today is inflammation, which you probably will have heard of. It's really common and implicated in a number of conditions that affect the body, particularly things like cardiovascular disease. But what actually is inflammation? Well, it's when a part of the body is painful or itchy, red, hot, and tender, usually as well. What causes it? Well, probably in hundreds of different chemicals in the body, which we call cytokines, that lead to inflammation. Now, inflammation can be a good thing. It's what your body uses for healing. So say if you cut yourself, the area will become inflamed and then heal. And I certainly remember my mum telling me when I was younger, if you've got a scab on your knee from falling over in the playground and it starts to be itchy, then that's a good sign that it's healing. So that's a good thing. However, if inflammation carries on in the absence of something, a reason behind it, then it's bad for you. You might have heard of a condition called rheumatoid arthritis, which is an inflammatory condition of the joints. And if it's left unchecked, you can get joint damage. So that's inflammation. The next reason I wanted to talk to you about is opioids. Now, this might come across a bit strange. What are opioids? Well, actually, they're naturally occurring chemicals in the body. The ones in the body that you might have heard of are called endorphins. But we do use opioids in medicine as well. They're medical opioids are things like morphine used as painkillers. Now, because they're naturally occurring in the body, you have receptors. And basically, in kidney disease, itchy receptors are imbalanced with the anti-itch receptors. And this is a useful treatment target we'll talk about later on. Now, here's the interesting bit. There's lots of anti-itch receptors in the body, and these are mediated by some kinds of opioids, otherwise known as endorphins. So basically, anything that get your endorphins flowing, pleasurable things, going for a walk, bit of fresh air, reading a nice book, anything like that, can actually help treat your itch, which is a really good thing to use later on. And the third reason why we have good evidence for what causes itching is actually nerve damage, which I alluded to a little bit earlier. Now, the nerves in the skin are often damaged by the condition that causes your kidney disease. Diabetes is an example, causing peripheral neuropathy. The nerves can then fire when they're not actually being triggered by an insect on the skin or inflammation or anything else, and this can lead to the sensation of itch. And this is a useful treatment target as well in the clinic. So that's inflammation, opioids, and nerve damage. Now, I might not yet have mentioned the cause that you might have been told before, and I've actually got a couple of myths to debunk for you today. The first myth I'd like to talk to you about is phosphate. I was certainly taught as a medical student and also as a renal trainee that high phosphate levels and also calcium and parathyroid hormone, this is the reason why patients are itchy. However, whilst this was thought about in earlier studies, perhaps several decades ago, the most recent research actually shows the evidence is very weak. Now, phosphate, as I'm sure you know, is one of the blood salts we measure in the clinic, and the levels are often raised at more advanced stages of kidney disease and if you're not dialysing very well. And nephrologists like me end up prescribing these ghastly pills known as phosphate binders, and I'm so sorry about those. They're big tablets, aren't they? The take-home message from this bit here is that I want you to know that if anyone tells you that you're itchy because you've eaten too much phosphate or not taken your phosphate binders, then that is nonsense, and that's not confirmed by the medical literature now. And another myth I want to debunk today is that about histamine, which is often implicated in allergy type conditions like urticaria I mentioned a minute ago and hay fever. There's actually very little evidence that histamine is involved in the itching in kidney disease. Now, this is interesting because a lot of doctors will automatically prescribe antihistamines if you come to the clinic and say that you're itchy, but usually in renal patients, it doesn't work terribly effectively. So we don't think that CKD-associated itching is mediated by histamine. Whatever the cause, we do know, of course, it's related to something to do with kidney failure. As for those that are fit enough and lucky enough to receive a kidney transplant, then the itching usually, not always, but usually does get better. So that's a quick tour of what potentially causes the itching in kidney disease, but I also wanted to talk about another skin condition that's really common in kidney patients, and this is just dry skin, uremic xerosis, which is the medical term for dry skin. This is also really common in kidney patients. We don't really know why, but in CKD patients, the sweat glands in the skin don't work very well, and that's why it ends up looking dry and flaky like this. Not only is it quite irritating, if the skin is dry, it can lead to the formation of itch. And you can imagine that where the usual skin barrier has broken down, bugs can get into the skin and perhaps cause an increased risk of infection. So those are the causes of itching. But why is it such a big problem? Well, if there's any clinicians amongst you, I'd like you to listen to this bit closely. The patients amongst you will already know this bit. Because of your skin condition, you're more likely to have scratching and trauma to the skin, which can lead to an increased risk of infection. But it's just not those medical reasons why skin itching is a problem, and I'm sure you'll agree. If it's particularly bad at night, it can affect your sleeping. It can also cause a reduction in your mood and even frank depression in some patients, sadly. And it can be quite frustrating to get heard and to find a treatment that works for you. In some cases, unfortunately, the appearance of the skin can be quite bad and people can feel self-conscious and don't even want to go out. And all of these things can lead to a reduction in quality of life. And this is quite frustrating from a medical point of view, as there are treatments available to try and help. So it's really important to get the skin itching under control. Before we move on to treatment, I thought it would be useful to let you know that there are a couple of things that actually can make the itching worse. Firstly, heat. If you get too hot in hot weather or too hot overnight, that can make itching worse in some patients. Stress can also make itching worse. Now, we talked a little bit earlier about the effect of the brain and the natural endorphins in the body can have on your symptoms. And it's easy enough to me to say that you should just reduce your stress levels. But I do understand that renal failure causes a lot of stress for patients, and I am sorry about that. I'm thinking things like hospital transport. I'm thinking things like delays in clinic appointments and trying to get medication from surgery and that kind of thing. It's a stressful condition at the best of times. And if someone's telling you that stress is going to make your symptoms work, I can appreciate that might not be helpful, but it's just so you're aware of why symptoms can get worse at times. Anything that damages the skin or removes the skin's protective natural oils can make your itching worse, such as washing too often, and we'll talk a bit more about that in a mo. And also anything that might irritate the skin. Funny enough, even some of the clothes people wear, such as woolly jumpers, can make itching worse. And if you're going to put anything on your skin, try to avoid anything with fragrance or perfume on it, because they're quite commonly implicated in symptoms getting worse. So let's move on now to talk about how to manage your symptoms. As I've said, there's quite a number of causes identified that might be causing the itching in renal patients, so there isn't really a one-size-fits-all treatment for everyone. Some patients need to try a combination of things, stepwise approach perhaps, and some people need to try one thing for a bit and then add in something else later. So I've got a few ideas to share with you this afternoon. How I manage itching in the clinic? Well, I have a stepwise approach too. I often start with conservative measures. These are things that you can do at home yourself, and then move on to topical therapy. These are things that you can rub into your skin, such as creams and lotions, and I've got lots of recommendations for you in a minute. If that kind of management isn't enough and you're still itching, there are a couple of tablets that have been shown to help with itching, and even now there's an intravenous treatment. There are plenty of other therapies you can come across if you do a quick search, and I'll talk about several of those as well. But here's the thing. Unfortunately, the evidence in the medical literature is somewhat limited, and there's also a large placebo effect. And this basically means, if you're not familiar with the term placebo effect, is that even if a treatment hasn't shown to be clinically effective, it can still work if you think it's going to work. So there's a huge effect that the brain and psychology of this condition can have on your symptoms. And I find that really interesting. With all the work that's been done, to date, there's only one licensed therapy that's specifically available for treatment of CKD-related itch, and that's the intravenous one, and I'll tell you about that shortly. But firstly, let's talk about what you can do at home to manage your itching, what we call conservative measures, and these are just the basic principles, really. Firstly, try and keep your skin as moist as possible, and also try to keep as cool as possible. It's also quite important to avoid scratching as best you can, and I'll show you some pictures of some skin that's been scratched shortly. The best way to avoid scratching yourself is actually distraction. Again, I'll just mention that if you do something that you enjoy, get the natural body endorphins flowing, it really does help improve your itch. And let's talk about managing your skin at home in a little bit more detail. I'll talk a bit more in a moment about how to keep your skin moist, but that's the most important thing in my opinion. In terms of keeping cool, I'd recommend if you can wear loose and lightweight clothing, particularly cotton fabrics are much better than wearing woolly fabrics, which are quite irritating. When you do take a wash, try to use lukewarm water instead of hot, and that should avoid the heat making the itching worse. When you're trying to avoid scratching, it's really important to keep your fingernails short if you can. And some patients even have some cotton gloves that they wear at night so they can avoid traumatizing the skin overnight when they're asleep. When thinking about the skin barrier function, it's important to try not to strip the skin of its natural oils with soap. So there are a number of different soap substitutes available on the market. One off the top of my head I can think of is Emollients, and they're available at any chemist or most supermarkets these days. And when you do take a wash, it's important to try and just pat your skin dry gently with a towel rather than scrubbing it with a towel to rub the skin dry, because that will just irritate it more. If your friends and relatives can stand it, I'd recommend just taking a bath or shower every other day or a couple of times a week, as that helps the skin retain its natural oils and should help your itching. So what's all this about scratching? Okay, so I spoke at the beginning that itching gives you the desire to scratch. That's only natural. And scratching does provide relief, but unfortunately it's only temporary, and I'm sure you'll agree with me with that. Scratching itself is a pleasurable sensation for most, and us as human beings, we're pleasure seekers, and it's quite likely that we'll do anything to make ourselves feel better. That's fair enough. However, the more that you scratch actually causes inflammation in the skin, and then the more inflammation you have in the skin, the more you itch, and then the more you scratch, and you end up in this horrible vicious circle called the itch-scratch cycle, and there's plenty of literature on this, particularly with eczema patients as well, and it's a really hard cycle to break. And what can then happen is you cause trauma to the skin, which can then cause permanent changes. These are excoriations. This is the medical word for self-inflicted skin trauma. And if you're scratching for sort of many weeks to months, you can actually end up with nodules on the skin. We call this nodular prurigo, and this is quite a common appearance of the skin in renal patients. And if it goes on for even longer, unfortunately, the skin can end up looking like this, which is really quite bad and can take a long time to heal. If you manage to break the skin barrier and bugs get in, you can end up with infections such as cellulitis, and you'll end up needing antibiotics if the skin looks like this. So I'll stop nagging now about scratching, but it's a take-home message to try and avoid it if you can. I appreciate it's much easier said than done. Let's move on now to talk about topical therapies. These are things that you can rub on your skin. There are hundreds and hundreds of different lotions and creams and things on the market, and I'll give you a few recommendations in a moment, and just a few general points to get started. If you can, it's useful to put on your skin lotion at least twice a day, perhaps one of those times after a bath or shower, to really trap moisture into your skin. Again, this is another thing that's easier said than done. It's actually quite tricky to put a decent amount of cream on your body, particularly on your back and other hard to reach areas. So you may need to ask someone to help you. It's also quite difficult to put cream on yourself if you've got perhaps arthritis or shoulder problems, or even a hemodialysis line in the way. So I appreciate, again, it's easier said than done. One top tip I have learned is if you put your cream in the fridge, and that just makes it extra nice and cooling and soothing for the skin. I do have a couple of things to take care, a couple of warnings here. Firstly, obviously, putting cream on your skin regularly will make you quite slippy, so please take care if you've got tiled floor in the bathroom, for example. And you may or may not know that all skin creams either contain paraffin or alcohol, both of which are flammable, which means that they can catch fire easily. And there's a campaign going on at the moment, following a few cases, unfortunately, of people that have ended up with burns because they've been using skin cream regularly. I just want you to be aware that skin creams can get into bandages, onto clothing, and even onto bedding, so do take care. What are emollients then? Well, these are topical rub-on treatments that you put on your skin to soothe and hydrate it. And there are a number of different types on the market. They're called different things depending on how much water they contain. The ones with the higher water content are easier to rub on, but don't last quite as long. Let me give you some examples. So we start with lotions. These are the runniest ones with the highest water content. They're quite easy to apply. They're quite light and easily absorbed into the skin. And perhaps an example that you might have heard of is Dermal. But there are literally hundreds and hundreds of different lotions that you can buy in any supermarket or chemist. A bit thicker are the creams. These have less water in than lotions, which makes it less easy to apply, and it takes a little bit longer to absorb. And examples that I've used are E45 and Aveeno. Thicker still are the ointments or the oils, and these have very little, if any, water content, which makes them really tricky to apply, and they take absolutely ages to absorb. But actually, because of this, they work for longer and are more effective. They're perhaps best used overnight rather than being slippery fingers all day because you've got Vaseline on your hands, but they are quite helpful. So that's emollients. But what if that's not enough? What if you're still itchy having hydrated your skin? Well, you can add an active ingredient to your emollient. And examples I quite like to use are things with topical anesthetic, so it numbs the skin. And an example is loramacrogol, which is a compound that's available to buy in Balneum Plus cream and E45 itch. They're both exactly the same, but I use these quite a lot in my patients. If a topical anesthetic isn't quite enough, you can also try menthol, which is lovely and cooling, particularly if you put it in the fridge. And it works by distracting from the itch sensation because it triggers the cooling nerves. But all of these creams are available over the counter. You can buy them in Boots, I think, but they're not particularly cheap. So it might be worth asking your doctor if they can put them on prescription for you, but they are effective. There's been several other active ingredients that have been tried in skin creams. You may well have heard of capsaicin. If you haven't heard it before, this is the active ingredient in chili powder, okay, which sounds a bit strange. But when you put a chili powder cream on your skin, what it does, it basically confuses the nerves, but it does start with a burning sensation, which doesn't sound particularly surprising as it's from chili powder. It has been studied in renal patients, but the studies were small and not particularly well designed. So it's not something I can recommend, but it can be tried if you're struggling with the other creams. Now, here's the bit that's interesting and perhaps disappointing. Steroid creams, which are basically anti-inflammatory creams, they're widely used in the itching with eczema, but unfortunately to date, they haven't been shown to be effective in CKD-associated pruritus. However, if there's any doubt about the diagnosis, there might be a bit of allergy or even eczema involved, I think they're worth a go, but they're only available on prescription. What about tablets then? There are a couple of tablets that have been well studied and have been shown to be effective. And this is a group of tablets called the gabapentinoids. You may have heard of them. Now, actually, this group of drugs were designed as anti-epilepsy medications, and you might think, what on earth are we on about here? But actually, when you think about it, epilepsy or seizures is when the nerves in the brain are firing when they shouldn't be. And CKD-associated itching, at least part of it, is where the nerves in the periphery are firing when they shouldn't be. And actually, structure-wise, the nerves in the brain and the nerves in the periphery are exactly the same. So it does make sense that anti-epilepsy medications can help. The two drugs available are called gabapentin and pregabalin. Now, here's the tricky bit. Both of these drugs are renally cleared. That means they're cleared by the kidneys, so they may hang around a lot longer than they would do if you had normal kidney function. And what this means practically is that we have to start with very low doses and sometimes infrequent dosing as well. Sometimes I start with every other day to see if patients can tolerate it like this. If you're on dialysis, if that applies for you, it's important that you know that these drugs are cleared by dialysis and they should be taken afterwards. And as ever with medication, they're not risk-free. Gabapentin and pregabalin can both cause side effects such as sleepiness or drowsiness. Take care if you're a driver. And also they do actually increase the risk of dizziness and falls. So they have to be thought about quite carefully in conversation with your doctor. But they have been shown in a number of clinical trials to be effective for CKD-associated itch. Other tablets you might be thinking about, of course, are the antihistamines. Now, as I've already mentioned and said to you today, that there isn't actually any good evidence that antihistamines help the itch related with CKD. However, if there's any doubt about the diagnosis, or you might think there's a bit of allergy involved, or there's a lot of inflammation in the skin, then there's no harm in giving them a try. You can choose between a sedating antihistamine. The most famous one you might have heard of is Piriton, or perhaps during the day it'd be better to try a non-sedating antihistamine such as Claritin or Zyrtec. All antihistamines, at least in the lowest dose, are safe for use in chronic kidney disease and can even be used in higher doses after discussion with your doctor. So it's worthwhile giving them a go, but I can't recommend them specifically for CKD-associated itch, as the clinicals show, unfortunately, there's not much benefit, but no harm in giving them a try. So I wanted to talk to you today about the new drug, which is actually given intravenously. This drug is called difelikefalin, which is a bit of a mouthful. Now, how it works to try and rebalance the opioids in the body that I mentioned earlier. If you're interested in the chemical term, it's a kappa opioid agonist. In the clinical trials, it's shown a modest benefit in improving itch scores compared to placebo. But interestingly, you'll see there that the placebo patients improved by 35% too. So this just shows the psychological impact and the power of the brain in symptom control, which I found interesting reading this trial. Side effects, thankfully, were infrequent, but a few diagnoses of nausea, diarrhea, sleepiness, which is somnolence, and dizziness were recorded in some patients. Now, in case you were worried about having an intravenous opiate, let me reassure you that difelikefalin doesn't have any of the pain-killing or euphoric side effects like morphine does, so you don't need to worry about becoming addicted to it, although it is, strictly speaking, an opiate drug. However, at the moment, it's only available for intravenous use, so it is only available for hemodialysis patients. We don't need to worry so much about the cost of it. It is an expensive drug, but it's centrally funded, so it's available for all renal patients if it's indicated. I'm not able to tell you yet whether it's more effective than skin cream or gabapentin, for example, as that's not yet been studied, but hopefully more trials will come out in the not too distant future. I think the company are working on different preparations and a different license so it can be used in other groups of patients, not just hemodialysis patients, but as yet, that's still work in progress, I'm afraid. So it's only suitable for HD patients at the moment. I'd like to just touch on another few therapies that you may have come across in a Google search or something like that. The first one is ultraviolet light therapy. Now, UV light therapy is used in other skin conditions, particularly psoriasis is a common one, but it's actually a bit of a faff. Despite it being shown to be effective, you have to have 6 weeks of daily treatment for it to be effective, so it's really hard work. Another one is acupuncture. Although the evidence is fairly weak in the literature, it's certainly been beneficial on a case-by-case basis for individual patients, but you have to pay for this privately. If you're on dialysis, it's certainly worth trying to optimize your clearance for lots of reasons, not just your itching. And interestingly, there has been a few trials looking at antidepressants. Again, this is a bit of a strange thing, but we think antidepressants change the chemistry of the brain, so it works differently, and that's how it treats depression, but they can interrupt nerve transmission in the peripheral nerves as well. And there's been work done on a couple of antidepressants I've listed there. I've talked quite a bit today about the impact of stress on itching and also the impact of the brain on symptom control. So it's certainly worthwhile having a think about mental health and even talking therapies such as cognitive behavioural therapy, which have been shown to be helpful with symptom control. The next three here are all basically fancy anti-inflammatories. You may think you haven't heard of them, but I bet you have. The first one is fatty acids. Now, what fatty acids are, they try and shift inflammatory pathways to anti-inflammatory pathways in the body. And you will have seen omega-6 and omega-3 fatty acids available in Boots. You can see them in vitamin supplements for arthritis treatment, for things like that. The last one I've listed there, gamma-linolenic acid, is actually otherwise known as evening primrose oil, which you might have heard of. And that's actually first-line treatment for itch in places like Australia. So it may become more common in use here. Zinc is another anti-inflammatory compound, and we all probably had zinc put on our skin when we were children, when we had chickenpox, otherwise known as calamine lotion, which is actually zinc oxide, and that has been shown to be helpful. And there's also been a couple of small trials with zinc supplements in tablet form, which probably do help itching. The last one there, turmeric, well, this is all the rage at the moment. Lots of people are taking turmeric for various anti-inflammatory properties. Turmeric is found in curry powder, and it contains an anti-inflammatory compound called curcumin, and it probably does help with itching, but you need to have a heck of a lot of it to be effective. So that was a bit of a whirlwind tour of various therapies for CKD itching, and I just wanted to quickly recap on some things I've talked about in the last 20 minutes or so. The first step in managing CKD-associated pruritus is to get the diagnosis right, to ask about it in clinic. And if you're a patient, do please speak up and talk to your doctor about it if you think this applies to you. I hope I've got the message across today, although it's easier said than done, that it's really important to not scratch if you possibly can and distract yourself as best you can. Anything that gets those endorphins flowing will help, I promise. It's really important to keep your skin moist. And if a simple skin cream isn't enough, then try one with a topical anaesthetic or menthol in to see if that will be helpful. But if you're still itching, talk to the doctor about trialling medications such as gabapentin. And if you're on hemodialysis, consider difelikefalin. I did talk briefly about a couple of alternative therapies that can be tried. In my opinion, UV light is probably the most effective, but also the most difficult to organise. But you could try evening primrose oil, which is available in any chemist, which is the GLA. So I do hope that's been helpful. And I'm very happy to take any questions. Thank you very much again for the invitation to speak to you this afternoon. Thank you.
Brilliant. Thank you ever so much for that. That was very enlightening. And
My pleasure.
Oh, I'm sure there's lots of questions from people as well as all the ones in the chat. So let's see if we can get through them in the next sort of 15 minutes. So what about scalp itch is the first question.
Okay. Yeah, as I mentioned, the itch can occur anywhere on the body. Scalp's a really common one. It's really important when you look at the scalp to really make sure there's no infection there. I'm thinking things like nits, which are actually quite common, and to make sure someone's really examined the scalp properly. But there are several creams and oils you can buy to put on your scalp. So itching can occur anywhere in the body, absolutely.
So what stage of CKD or EGFR level can itching become a problem?
Any. I was certainly taught as a trainee that it only affects the latter stages of chronic kidney disease, but that's nonsense. It can happen even earlier stages. I've had patients that have normal kidney function, but have abnormal kidneys. So they're under my clinic and they often complain of itch. So I don't put this down to renal failure. I put it down to the way the whole body is affected by the kidneys. So I certainly wouldn't rule it out. Oh, your kidney function's good. It's not due to kidneys. But I take it seriously whenever a patient mentions it.
So this next person's asked, I have ADPKD a kidney transplant now, and I still have itch. Is this normal?
Very good question. Yes, you still can have itching. It usually does improve, and not always completely, but normally does improve with the transplants. So I just wonder if this patient here has good function with their transplant, or whether it's not quite perfect. But it's, as I mentioned, it's really common to have itching at any stage of kidney disease, transplanted or not. Presumably, if you've got a transplant, you'll be on drugs to suppress your immune system. So it's worthwhile chatting with your team whether there might be any side effects or something that's worth thinking about. But although I did say that it usually gets better with a transplant, it's not always the case, unfortunately.
Now, this next one's more of a statement than a question. It's certainly true that it's hugely underestimated by medical staff.
Yeah, I can only really apologise for that. I'm certainly trying to change that locally, and then with work we're doing with the UK Kidney Association. Have to admit it wasn't well taught when I was a trainee. It might have been mentioned once in the corner of a lecture somewhere, and that's our fault as medics. And I am trying to change that, I promise. But the most important thing is we should be aware of it, ask about it, and then ask about it again next time to make sure you fixed it.
Now, this next person has had a transplant for 27 years, and they've said that their itching is getting worse.
Okay. No, I'm sorry to hear that. I just would be interested to see whether the listeners brought it up with their own team to see what their team think. But after 27 years, that's a fantastic result for a transplant, isn't it? But I'd want to know what the function was on the transplant, and whether it was related to progressive chronic kidney disease in that particular patient. But as I said, it can happen at any stage. Hope it gets better.
Now, this lady has put, no one has looked at my husband's skin, even though the itch is getting worse and causing much distress.
This is really frustrating from my point of view. I'll just sort of mention again that CKD-associated pruritus is basically a diagnosis of exclusion, as in you really have to look at the skin and make sure you're not missing anything else. Is it eczema? Is it an infection? Is it an allergy? And then if you rule out everything else, then you can get on and treat it as CKD-associated pruritus. But why would they not look? Why would they not look? So I'd read next time you go to clinic, I don't know, say, please, doctor, have a look at my back.
Ask the question. Yes.
Yeah, absolutely.
Yeah,
Moan.
definitely. Can psoriasis aggravate the itch? I think I know the answer to this myself.
Absolutely. Some people's psoriasis, bizarrely, even though the skin looks, sort of scaly and inflamed, it's not always itchy. Some people with psoriasis itch an awful lot, particularly if it's on the hands, but if it's on the other part of the body, it doesn't itch quite so much. But because of the inflammation that psoriasis causes, absolutely, yes, it can make the itch worse. Absolutely.
Next question. I'm at stage 3B, and the nephrologist has told me that it won't be the CKD causing the itch.
Come and see me. Where do you live? Yeah, I don't know why. This is a training issue, and I'm so sorry. I'm going to apologise on the behalf of the community here, but itching can definitely occur at any stage. The inflammation we see happens at an earlier stage. That's, to be honest, while we focus on other things, not just the chronic kidney disease. I mentioned cardiovascular disease there. We try and focus on that at an early stage, make sure the blood pressure's okay, make sure the cholesterol's okay, that kind of thing, because we know that no matter what stage of chronic kidney disease you are, the risk of these things goes up. So I'm sorry if they don't feel listened to. Go back and ask again, definitely. And get them to look at this on YouTube.
Questions are coming in thick and fast now. So I tend to get itching around my ankles. Not sure if it's related to my declining kidney function.
Yes, I suspect it will be. But around the ankles, that's also the part of the body where swelling can happen, what we call edema or water retention. And if the skin gets stretched, actually that can make it feel a bit inflamed. And a lot of people find itching happens on their legs a bit more commonly. So yeah, I bet it's related to the kidneys.
My phosphate is high and I take phosphate binders. Luckily, I've never had unbearable itching. I've been on dialysis since March 2024 and I'll make sure I moisturize properly.
Fantastic. Thanks very much for the comment. Exactly right. Moisturizing properly daily, twice a day, even 3 times a day if you can, really, really helps. And it protects the skin from bugs getting in as well as making it less itchy. So you're definitely doing the right thing.
So
sorry
taking
about phosphate binders.
antibiotics has triggered it. when I was on dialysis. So more of a statement. Is that common?
It can happen, sure. It just thinking about antibiotics, it might have triggered perhaps an allergy. Penicillin is really common at doing lots of different antibiotics as well, so I wouldn't be at all surprised that it started something. Perhaps mention it to your team and don't take that same antibiotic again, because if you're allergic to it once, the next time you take it, the reaction might be worse. So yes, I have seen that, definitely.
So I don't know if this one's a strange one or not, but does anyone else have dry skin inside their nose?
Good question. Yes, absolutely. You can get dry skin anywhere, I suppose. But thinking about the nose and even the eyes, there are a couple of specific conditions that could be. I don't know whether this patient has dry eyes as well, but dry skin in the nose is really annoying and really irritating. So I do really feel for you, but it's quite difficult to put moisturizer in your nose, isn't it? So it's probably worthwhile asking the doctor to have a quick look up there, make sure there's no, I don't know, polyps, or is it hay fever, something like that. But that does sound really irritating. Sorry.
So dry skin and itching are symptoms experienced during perimenopause and also menopause. Is that the case?
Yeah, absolutely. Absolutely. If you've got chronic kidney disease, I'd be inclined to treat it as I've mentioned this afternoon, but absolutely dry skin and itching and funny sensations. It's got a funny word. I'll be careful how I say this. It's called formication with an M, and it's a sensation of ants or insects crawling on the skin. And that's quite common in the perimenopausal and menopausal stage of life as well. So I'm not sure whether the GP would specifically consider menopause treatment, so hormone replacement therapy, just because of dry skin and itching, but it's certainly worthwhile asking for lots of reasons. I'm a big fan of HRT, recommend it as well for lots of other indications.
And talking of menopause, we are doing a webinar about menopause and kidney disease coming soon. So please look
Perfect.
out.
I think I will join that myself.
So can excess fluid in the body cause itching?
Well, yeah, in a way, as I said a minute ago, thank you for the question. It's really important because I just wanted to say that kidney patients have a lot of symptoms. It's not just itching. There's a whole lot of things can happen. There's fluid retention being described here, but there's loss of appetite, nausea, vomiting, you name it. There's lots and lots of different symptoms that we need to treat in the clinic. And when you've got excess fluid in the body, it will cause stretching of the skin, irritation of the skin. So absolutely, that can not help if you've got itchy skin as well.
Someone's put, thank you for a lovely talk. I really appreciate it, especially working in a HD setting. I will share this knowledge with my patients. So
that's very kind. Thank you. And that's the plan from today, is to get this out there, really hammer home how important it is and how you can start with the basic advice you should give all patients to try and treat it.
and a quick mention of the watch again. This is recorded. So if you know someone that will benefit from this, look out for the email tomorrow with a link on it for our YouTube channel, and you'll be able to watch it again or share it with someone. Another question. Told to avoid omega-3 and 6.
Yeah, I've just seen that. I'm quite interested to hear why. We use these anti-inflammatory fatty acids actually as part of treatment for some kidney diseases. The one that springs to mind is IgA nephropathy. I don't know if anyone familiar with that term, but it's a common inflammatory condition that can lead to renal failure. And omega-6 is part of standard treatment for that in some patients. So I'll be interested to hear why they were told to avoid them. It's interesting. They're available over the counter. You can just buy them.
So I think you've mentioned this already, but someone's put, would taking turmeric in powder form help?
Very good question. Thank you for raising that. Well, I did mention turmeric as useful in anti-inflammatory for anti-inflammatory reasons, as well as itching. Trials have been done, and it's not as though it's a miracle cure, but it can help. What I mentioned is that you need to take a heck of a lot of it. And in the trials, the amount you need to take to help your itching, they literally made a fist, as in a fist worth of turmeric powder, which is a heck of a lot, and you'll probably turn orange and it might be irritating to the stomach. So we haven't yet been able to concentrate it into a form that I think could be clinically useful, but absolutely no harm. It's getting really common. People take turmeric for lots of reasons, and it's not known to be harmful at all. And who doesn't like a curry? Have a curry, see if that will help.
Can diet make a difference with the itching?
Ah, very good question. Thank you. Now, I'm going to say no to that because we know that changes in blood biochemistry isn't really associated with what's causing the itch. We used to think that, but we don't think that anymore. Having a healthy diet, a renal diet, which is really tricky to adhere to, I know, it can help for your general health and lots of other reasons, but there's no specific diet that I can recommend that's been shown to help itching specifically, I'm afraid.
Another person wants to know if excess water affects itching. I think we've had this one already, haven't we?
Yeah, but no, thank you for reinforcing it. Repetition, it's good to, for me as well, to know that actually, yeah, I need to think about this a bit more. If someone's got swelling legs, I need to ask them about itching as well, because I can see it's a big problem for patients.
And then we've got loads of people being very complimentary about your talk. Lots
That's
of people saying the information has been fantastic, really helpful. Thank you very much. Extremely clear and helpful. What a great webinar. So pat yourself on the back because I think everyone agrees it's been a great one. Let's fit in a couple of more questions before the end then. So tea tree oil has been mentioned as well.
Oh, thank you for bringing that up. Yeah, anything's worth a go. Tea tree is quite cleansing for the skin. It's often prescribed for things like acne or spotty skin on the back. You can buy it in Body Shop, I think, and it's useful for that. But because it's quite cleansing, I might kind of worry that it strips the skin of its natural oils. But as with any of these things, anything's worth a go. It's quite cooling on the skin. So why not give it a go? But there's, to my knowledge, it's not been studied specifically in CKD associated itch.
Let's have a couple more questions then. What about vitamins B1, B6, B12, and plus R?
Where are we?
Um,
Perfect. Okay. So I actually use vitamin B complex quite often in my patients because it's been shown to help with other symptoms like cramp, which is another common one. I haven't got time to go into the major treatment pathways for cramp, but I use vitamin B complex a lot. I haven't used it specifically for itch, but I don't see why not. It's good for you anyway. A lot of B vitamins are washed out with dialysis because they're actually water-soluble vitamins. So I often get patients to take B vitamins anyway, and I will have a look to see if there's any work done on B vitamins and itching. To my knowledge, there isn't. And you've put there about an acid. This is perhaps a fatty acid. So, yep, it will hopefully switch the anti-inflammatory pathways to be more prominent than the inflammatory pathways. So I'm a big fan of fatty acids as well.
Right, last question, I promise. I feel a small amount of alcohol increases my itching. Is it likely?
Very good question. Honest answer, not sure. Off the record, a little bit of alcohol helps most things. Don't tell your doctors I recommended that because it's not appropriate for all patients or not culturally appropriate. So I'm aware of that. To be honest, this one might be worth bringing up in your clinic because every now and again you come across a patient who has some alcohol and it makes one or two symptoms worse, and it can be an indication of something else inflammatory or something going on. So I recommend to that patient to have a chat with their doctor. But generally speaking, in renal failure, it's fine to have a small amount of alcohol if that's your thing.
Well, you deserve a glass of wine or something now because you've been absolutely fantastic. Thank you very much.
That's my pleasure. Thanks so much for inviting me again.
It is going to be recorded, or it has been recorded. So tomorrow you'll be able to watch again or share this with friends and family. We have got more webinars coming up throughout 2025. So please look out for the emails. And thank you very much and have a great evening.
And thanks so much for all the questions as well. That's really thoughtful points for me to go and look up as well. Nice to meet you all.
Thank you. Good night.
And thank you, Pete, for organizing it.
Thank you.
You.